So journaling about this practicum experience is kind of interesting, just because what has happened in the past 5 or 6 months with my preceptor and all of the experiences that we had. It's really hard just to draw from a few. But it has been also, with this extended length of time, been really amazing to be able to really work on a lot of projects from start to finish. I remember just in the first couple of days of working with my preceptor, Kelly, she had a couple things fall on her plate. Some issues that some of the nursing staff had brought up and the nurse managers had brought up, and then watching how this issue turned into a project that she worked with and collaborated with a lot of different team members on, and then made something that was an online education that was mandatory for all staff, and had to train some expert trainers, if you will, on certain skills, and then get all of the nurses checked off on it. So I mean, that was a really cool part of being able to do this 5-month process with Kelly, especially just to be able to see truly the process for getting some of these projects. I think it was fascinating to see how long sometimes this kind of stuff takes, but also realizing the amount of different players and pieces that have to go into finishing one of these projects, and just kind of the organization that goes into it. It kind of does make sense on the other end, to see why it might take so long. But it's different because I'm used to kind of being able to be independent in certain ways with my job, and also especially with school. And so I'm on my own time, and when I want something completed, I just do it. But of course, it's very different when you have to work with a lot of different people and work on their schedule and their timelines and all that good stuff. So there's actually 2 experiences that I wanted to talk about that I learned just a ton from. The first one is this big project that my hospital is working on. They call it upskilling, but basically it's taking the nurses who are trained just on the medical or surgical units, and they want to get all of these nurses, or at least the majority of them, trained so that they can handle more critical patients. So that their IMCU level, at least that's what our hospital has, which is an intermediate care unit, they're able to handle patients on BiPAP. They're able to handle patients with cardiac rhythms that require certain drips, not ICU level status, of course, but just those that are a little bit more critical, so that we have more beds available essentially for these types of patients. My preceptor was brought into this because she is the critical care educator at the hospital, so that's her units, and she worked a lot with the adult health educators as well, the professional development specialists for the adult health units, and they kind of had to collaborate with all of the different managers on all of the different floors to kind of figure out a game plan of how they were going to be able to get all of these nurses trained. And I could see how it was very challenging for her, because she had created this critical care new graduate program with 10 weeks of extensive classes that was to be done in conjunction with them precepting on the floor, so they'd kind of learn and then do a class and learn and do and get the real world practice and all that kind of stuff. It was really something that was geared more for 10 or 15 students, new graduates, and now they're expecting to get hundreds of nurses through this program as well. And so I could see the challenge and hear the challenge from her in trying to figure out how to make everybody happy, how to get these nurses trained, but also to save the basically this program that she'd worked so hard on, and not to have to ruin it, so that these new graduates aren't getting a fulfilling experience, because now they're stuck in a classroom with tons of other experienced nurses. Maybe their questions would get lost, and also just a lot of the skills that she's training on, she doesn't have the resources to be able to do for huge classes. So she worked with the adult health professional development specialists, like I said, and so what they ended up doing is they've got all of the charge nurses going to go through Kelly's critical care program. Then all of the other nurses, the ones that are currently employed at the hospital, are going to go through an expedited version that is run by the adult health PDS, and they're just going to get the essentials in a much quicker, more expedited version. Like I said, that's not going to gear as much for a new grad, but it's going to gear for experienced nurses. And then going forward, any new nurses hired to any of these adult health units that are upskilling will then go through Kelly's class. And she's going, she and the adult health PDS will work together if there's large classes so that they can man more skills labs and kind of get that accomplished properly. So I thought that was just a really good learning experience because it shows the compromise that is involved because obviously she has her way of how, that she doesn't want to compromise that integrity of her program, but also knowing that, okay, we have to do something. This is something that is going to be happening and it's got to be figured out. So that was really interesting, and be able to be part of those meetings too with some of the management and kind of seeing their perspectives on it as well, and hearing just them telling Kelly, well, you got to figure this out pretty much, and her having to go, okay, all right, this is happening whether I like it or not, so I got to figure out the best way to make it best for me and for everybody else. Another experience that I thought was fascinating from this side of it was we actually just had our Joint Commission come, and they surveyed our hospital, and one of the things that we had to work on and we had to fix quickly was that our Mars were having duplicate meds on it. And in a couple different ways, like there may be a couple of like the same category of medications ordered, and there was no explanation or orders from the doctor about which one was supposed to be used first. And that is also congruent with pain medication, where we might have a pain for this category, but we could have multiple pain meds like Tylenol and ibuprofen ordered for mild pain, but no explanation for the nurse about which one they were supposed to start with. And so technically that would be working outside of their scope per the Joint Commission. So Kelly got pulled into this one. So it was meetings with 2 doctors that were kind of like the heads of the hospitalist groups, 2 pharmacists, and then she and another professional development specialist were essentially the nurse voices on this team, but they're nurse educators. So it was challenging because neither of them have been on the floor recently, and so they don't quite know what it's like to have to make, to be actually giving out pain medications and see it from the nurse's perspective. But of course, her big role is to take ideas that came from their meetings, take it actually out to nurses working on the floor, say, would this something that would be actually feasible for you? Does this make sense? Does this read well? Basically, they've decided to make a little order set that goes with every pain medication, basically telling you which order you should be going in when choosing pain medications. Of course, choose oral over IV if it's for the same pain level, or Tylenol over ibuprofen first, et cetera, et cetera. So kind of allowing for more consistency, and also for nurses to not be outside of their scope. But of course with the Joint Commission, there's such a fast turnaround. And so within a week, she had these meetings. They came up with a prototype. The day that I was shadowing her, we were going out on the floors, giving them to the managers and saying, we need your nurses to use this for the next week, because we need to, and we need them to fill out this checklist and let us know if it was useful, if it was helpful, et cetera, so we can have data, because Joint Commission is going to be here and we need to show them that we have already started a test of change and that we're getting results from it. So that was just fascinating to watch that whole process, and again, how quickly everything kind of had to fly. Something that I feel like least added, it's not exactly one specific experience, it's a lot of experiences as far as, and this could be just a little bit my own opinion from currently still working as a nurse, and I'm in an outpatient clinic, so our world is very different. We're very much on a structured routine. We have a patient who comes and this is their appointment and this is the time, and we have this amount of time to get them in, get them out, etc. But there is also a lot of behind the scenes stuff that we have to do for patients in an anticoagulation clinic. We know we're organizing a lot of procedures and starts and education, etc., etc. Anyways, so we have little to no downtime. I clock in and I clock out, but I can guarantee in those 10 hours that I'm working, other than breaks, I'm going. And I feel like that is often what it feels like to be on the floor as well. Like your days are really busy or your nights are really busy and you're just going and you've got your groove. Well, to work with somebody, shadow with somebody whose salary, just to see the absolute difference in time, and I do think that Kelly was extremely efficient with her time, as were all of the other PDSs, but the amount of meetings that they had to go to where I felt like this really wasn't necessary, or this kind of seems like a waste of time, or we got to spend 2 hours one day just going to a going away party for somebody, which this is all fantastic stuff. But again, my mentality is, no, you're at work. We got to go. Because if we don't hustle, we're not getting out on time. That kind of philosophy. So it's definitely a change in mentality of what an educator, and the fact that your time, you do what you need to do. You have a deadline, but you have this amount of time to get it done. So you figure out how that happens for you. Or yeah, you might have this meeting here, but the rest of the day, it's kind of yours to decide how you want to do it and which projects is going to take priority. And the amount of emails that she had to answer and stay on top of. Walking into, after a weekend, 150 emails sitting on her plate. I mean, that's pretty insane. So I guess what I learned from that, I think my personality will hopefully, in an educator role, and I don't know if I want to go to the hospital or if I want to go more of in a university setting at this point, but to just kind of, I don't know, it'll be interesting to kind of figure out the time, how my time works, because it will be different. There will be, of course, classes and things that, of course, have to happen at the time, but that extra time, and to see how things pan out with that. Anyways, my time with Kelly was unbelievable. She was fantastic. I learned a ton, and I'm so excited to go forward with nursing, nurse educator. So yeah, thanks.